Welcome back and thanks for staying with us. Let's take you to this now. SweepSouth has released its 7th annual report on pay and working conditions for domestic workers. The report reveals a stark picture of the sector. Despite a slight increase in earnings, the soaring cost of living has left domestic workers struggling to make ends meet. Job losses fueled by economic pressures have exacerbated the situation, leading to widespread financial insecurity and deteriorating mental health. SweepSouth Group COO Luke Kannemeyer joins us now via video link to unpack the report. Luke, thank you so much for your time. We've always known, of course, that domestic workers have played a critical role as primary breadwinners and continue to do that for their families. Just talk to us about the key findings of this report.
So in this year's report, and thank you very, very much for having me, we saw that the demographics of domestic workers largely remain the same, where just over 90% of domestic workers are women, overwhelmingly bearing a significant financial burden, with 83% being the sole financial provider in their home, supporting 4 dependents. And I think that just is where we see this sector and its importance in South Africa, is that these primarily women are supporting a significant number of people across this country. And then we also saw here that we see job losses. So 1 in 5 of our respondents lost all employment in the last year. And that's primarily due to relocation and affordability. And then even those who remained employed as domestic workers, that up to around 36% of them lost some of their work due to affordability issues. So we see a pressure on workers, as you say, in terms of their cost burden relative to their earnings. But then we also see economic pressures from the employer side, then feeding into the lives of domestic workers and all those that they're requiring support. And yeah, we also then investigate other things like mental health, abuse, all of those things. And we do see this feeding through in all of those factors as well.
And I want us to unpack some of those factors. I mean, it's oftentimes that you see on social media how people are continuously debating on what is the right salary for domestic workers. A lot of people, of course, in this country, and just having looked at the unemployment rate, have also lost their jobs, you know, due to economic pressures, etc. But just talk to us about where then can employers meet domestic workers, you know, halfway, particularly as we start looking at soaring rates of financial insecurity and debt.
Yeah, so when we look at that from an employer side, I think one of the #1 things that we encourage employers to take to heart is that this is not a cost that or the pay of their domestic worker is not something they should be looking to see how can they get that as a cheaper rate as possible. That to recognize that the way that they want to be treated when they go to work, both pay and working conditions, is the same way that they treat their worker. But there are other ways, you know, sometimes it means reducing the frequency, but we even see things where, you know, maybe there's not a full day's work here, and then the person next door also can't necessarily afford someone full time. Can you share half a day for one of you, half a day for the next person, to still ensure that, you know, these costs are kept under control for yourself, you're still able to provide employment, but that your worker still earns a living wage at the end of the day.
And just talk to us about, you know, your report mentions the deteriorating mental health, you know, amongst domestic workers, saying here that mental health is a major worry, with 16% of domestic workers reporting a decline in the past year.
Yeah, so this is a topic that we've looked at for a few years now. Just it's something that's very close to my heart, and it's something where we try and give a broader picture of the lives and the circumstances around our domestic workers. And this is where we continue to see that access to mental health treatment, only around 27%. So 1 in 3 workers said they could see a mental health professional in the last year. And 16% of them noted that there was significant decline, primarily due to this precariousness and fear of unemployment, and then also stress being a big factor as well. And so that does show a worrying trend here amongst our workers. But you can all see this where it starts at the top, the trying circumstances that our workers are having to operate under, and that then does have other outcomes.
How much of COVID-19, how much has that impacted on what we are currently seeing today? In effect, in as far as this report is concerned, I mean, have conditions drastically deteriorated since COVID-19? Are there different trends that particularly employers are then adopting?
So what we see that what the COVID pandemic caused was a significant contraction of the industry. So domestic workers made up well over 1 million workers in the country prior to COVID. And while we've seen a slight increase post the sort of end of the pandemic, we're stabilizing around 850,000 jobs, which is still 15% down on what we saw before. And I think what you're seeing here is that many of the relocation issues, the affordability, inflation, many of those things are closely entwined with what happened during the pandemic. So to tease that out from the current circumstances of domestic workers is quite challenging, but suffice it to say that yes, the contraction of the industry and where are those people now in terms of their dependence and the money that they're needing to be earned, that is a grave concern. But then those that remain employed, that COVID and all the financial insecurity worries are definitely entwined.
What are some of the courses of action that you would recommend as a business that regularly, takes this data into course? Because we have laws that should ultimately be protecting domestic workers. So where then do you think the line should be drawn in as far as taking care of domestic workers and seeing them as employees in any organization, as an example?
Absolutely. So I think this is where South Africa has really some of the best legislation in the world when it comes to domestic workers. And what the difficulty that we have here is, many will say enforcement, but even where we see it is that it's more upstream. The issue is just the access to that. So yes, you're entitled to occupational health and safety or COIDA now. Yes, you should be covered by UIF and your employer should be able to register you. But many of these systems are very complex for individual employers or in a home to be able to provide access to that. And this is where I have seen, like with us as a technology platform, that if we look at introducing more of technology into this to ease the process, that once we promote wider access, that is really then where we can see much of that legislation being able to be enforced more strictly, but also that the impact of that legislation is felt amongst domestic workers.
Luke, thank you so much for your time. Really do appreciate it. Luke Kannemeyer is the SweepSouth Group COO.